Good afternoon. My name is Christine O'Brien. I am an assistant professor of biomedical engineering, and my lab is focused on developing low-cost and light-based technologies that solve global, meaningful problems in maternal health. I'm really excited to share with you today some technology that has spun out of my lab that is being commercialized by my startup company, Armor Medical. Our technology, Maternal Armor, is developing an early postpartum hemorrhage diagnostic that has been designed to save lives. I am extremely fortunate to be joined by a fantastic team of multidisciplinary experts. Our fearless leader and CEO is Dr. Kelsey Mayo, an engineer and an entrepreneur who has already been recognized as a change leader and femtech innovator. I am also joined by Dr. Leo Shmoilovich, a dermatologist and physician scientist whose lab is focused on developing equitable skin diagnostics. You may not be aware, but the United States is currently in a maternal health crisis. The US is the most dangerous country to deliver a baby in amongst our economic peers. And globally, a mother dies of a pregnancy-related complication every 2 minutes. Just take a moment to let that sink in. The leading global cause of maternal death is postpartum hemorrhage, accounting for 1/4 of all of these deaths. And for every death, there are 100 near misses in which the patient could have died. Disturbingly, in the United States, our Black mothers have a 3x increase in deaths caused by hemorrhage. And this is particularly disturbing when we consider that up to 90% of these deaths are preventable with earlier diagnosis and earlier treatment. And together, this is costing our healthcare system $1.8 billion annually. So postpartum hemorrhage is such a problem because our providers have a substandard standard of care. And that is visual estimation, in which they literally have to wait for blood to flow out of the patient's body and then eyeball a puddle of blood and blood-soaked sponges and try to come up with some sort of number that would lead to a hemorrhage diagnosis. As you might imagine, this is not particularly accurate, and in fact, it performs worse with the higher stages of hemorrhage. And as a result, our providers are behind the 8 ball and catching hemorrhage at very late stages when high cost and often inaccessible treatments are required to save a mother's life. Instead, we aim to detect hemorrhage at early stages when low cost and accessible treatments can be prescribed. Our solution is Maternal Armor. It is a wrist-worn device paired with a perfusion monitor. The very first compensatory mechanism our body performs to protect itself during a hemorrhage event is it shunts blood from the periphery, like our hands and feet, towards the core, to our vital organs. And our system is designed to detect this decrease in peripheral perfusion and identify this very early indicator that hemorrhage is occurring. In addition, our device is also able to help monitor resuscitation efforts to ensure that indeed the patient is responding to this treatment and their peripheral perfusion is increasing. I'd like to walk you through what it might look like to see Maternal Armor in the clinic. On the left here, we have Kira, who has been admitted to the hospital for labor. And upon arrival, a nurse midwife puts Maternal Armor on her wrist. From this moment on, Kira is going to be proactively monitored for hemorrhage risk. And after her delivery, indeed, Maternal Armor identifies a high-risk postpartum hemorrhage signature and immediately alerts her healthcare team. They are able to quickly perform simple uterine massage and give some low-cost oral medications and monitor this resuscitation effort with Maternal Armor. And they are able to quickly halt the hemorrhage and send Kira home happy and healthy with her baby. I'd now like to contrast this with our current standard of care. So once again, Kira is admitted for labor, and once again, she has a hemorrhage event. Her healthcare team is looking at these blood-soaked sponges, looking at the puddle of blood, and unfortunately, her hemorrhage is not diagnosed until her vital signs crash. At this point, Kira has lost a tremendous amount of blood and requires an emergency transfusion. Thankfully, Kira is in a hospital that has a stacked blood bank. But many moms, especially those living in maternity care deserts, do not have access to this type of life-saving treatment. In addition, Kira has a life-saving hysterectomy performed. However, she has now lost her future fertility. She is then kept in the ICU for a week and thankfully is eventually sent home, but she is exhausted, traumatized, and sick. I'd also like to draw your attention to the vastly different timelines of these two scenarios, as well as the economic burden associated with each of these outcomes. On the left, I'd like to show you an example of one of our wrist-worn prototypes, and on the right, I share some exciting data that we obtained from a swine hemorrhage and resuscitation trial. In green, you can see our hemorrhage and resuscitation protocol, where at about 35 minutes, we started withdrawing blood from the swine. And you can see in our red armor signal, our signal started dropping immediately and continued to drop with increasing blood loss. In addition, when we performed resuscitation with IV fluids, shown in blue, our maternal armor system spiked right back up, demonstrating that the resuscitation efforts were being successful and the patient was responding. These are very exciting and promising results that support moving this technology further. We have a considerable competitive advantage compared to our competition. Our main competition is VasoWatch, which is an emerging company, and their technology is based on the same technology as pulse oximeters. And unfortunately, pulse oximeters have recently gained attention for having particularly poor signal-to-noise ratios. And this is particularly true in low perfusion states such as hemorrhage. In addition, they've gained national attention for having disparate performance across patients with different skin tones. And this is hugely problematic considering we already have an unacceptable disparity in our moms of color. And fortunately, signal-to-noise ratio and performance across skin tones are areas where maternal armor shines. In addition, we have designed our device to be low cost to make sure that all patients can access it, especially those in these maternity care deserts. So our total market includes all US hospitals, and that's really because this technology could be used beyond obstetric hemorrhage. But we are going to initially focus our SOM on maternity hospitals with key group purchasing organization contracts. If we are able to get contracts with the 3 leading GPOs, we will be able to penetrate half of the market and 1.7 million births per year and over a $760 million market potential. We aim to be on the market by 2025, and the first step will be obtaining exclusive license to the IP. We have worked with a regulatory consultant and identified multiple predicate devices, and we'll be pursuing a 510(k) pathway as a Class 2 medical device. Initially, we will be focusing on value-based hospital systems who are most incentivized by cost savings. In parallel, we will be applying to CMS for a CPT code to help increase our market access to the traditional fee-for-service models. We plan to pursue a medtech as a service revenue model, and we have purposely priced our device at $150 per patient in order to give our customers a 3x return on their investment by reducing avoidable healthcare costs, also a 3x reduction in readmission rate, and most importantly, improving upon our maternal health outcomes, which are often tracked on insurance contracts and possibly incentivized or penalized depending on a hospital's performance. We have only been a company for a year, and in that very short time, we've reached a number of really exciting milestones. We have also successfully raised over $250,000 of non-dilutive funding and are currently on track for a launch in 2025. Today, I am asking for $250,000 of pre-seed that will help us create alpha prototypes. And this will help make us highly competitive for an additional $800,000 in non-dilutive funding through the RADx Tech for Maternal Health competition that we are currently competing in. In addition, we would love introductions to economic buyers in value-based hospital systems to get feedback on our value proposition. At Armor Medical, we are dedicated to making sure that no family has to hear the devastating words that their mom won't be coming home. We have the technology to stop these preventable postpartum hemorrhage deaths. Please join us in making sure that all moms like Kira are able to go home safely with their babies. Thank you.